The following program contains mature subject matter. Viewer discretion is advised.
After all my crazy times of growing up at the Playboy Mansion, the one addiction that still lingers is sugar. It was my first drug of choice at 11, and to this day, candy is something that I'm still addicted to. I eat so much candy that I usually keep some by my bed and eat candy in bed as I'm trying to fall asleep at night. Because I don't have health insurance and I haven't had a physical in forever, I have been gaining weight. It's just super frustrating. Who knows, I could even be pre-diabetic. I know that I really want to quit the candy, I just don't know how.
We are back with Jennifer, whose childhood growing up in the Playboy Mansion left a trail of trauma in her adult life. And joining us now is licensed naturopathic doctor Holly Lucille.
Hi there.
So Jennifer, Dr. Holly, she set you up with an extensive blood panel, which you were supposed to do while fasting. We hear that you couldn't put down the sugar even for one night.
Yes, that is true. That was tough. I'm sorry. Did I fail that test?
Jennifer, what happens if you don't have that sugar at night? How do you feel?
Oh, it's just difficult to fall asleep. And
Yeah.
even last night, I mean, just red vines or Starburst or any sort of candy.
Red
it
vine
just
sounds
instantly,
pretty good right about now.
It does. It soothes. And it's very interesting, Doc. You know, there's a very common swap, right? You know, I treat a lot of substance abuse in my private practice. And so as folks are on that journey to getting clean, they will often replace it with sugar, right? And there's a very good reason why. Sugar gives you that dopamine spike, right? Gives you that boost of energy that you get.
Right.
It's that pleasure center reward, right? I feel this way, I don't really like it. I can put this thing in my body and I can feel something different. And so it kind of reinforces that cycle.
She's probably stimulating those dopamine receptors and putting her in her happy place, which allows her to then fall asleep.
Right? It mimics that happy place she had found with the other drugs early in her life. You got it. Spot on.
All right. To you, Dr. Holly, what did you find with Jennifer's blood tests?
The biggest thing that I saw was her overall cholesterol was elevated. But more importantly, her ratios were off, right? So total cholesterol at 273, but then we've got that protective HDL cholesterol that's lower. And what we all know is the bad cholesterol, LDL, is actually elevated. But then when it comes to the sugar part, we got to look at her triglycerides. And her triglycerides were very elevated. So if you think about the word triglyceride, tri is 3. Glycerol is a sugar molecule. So 3 sugar molecules on a fatty acid backbone. That is indicative of her sugar intake. And then as well, if you look at her glucose level and then her hemoglobin A1C, those were basically high normal, right? So what we're seeing overall is a setup for something called metabolic syndrome, okay? So this is putting her at increased risk for cardiovascular disease, diabetes, strokes, obesity, elevated blood pressure, and then bigger is something that is so prevalent right now in our country. 20 to 40% of folks are having something called non-alcoholic fatty liver disease. And that is what sugar can get you. So it's kind of the situation where you do what you've always done, you're going to get what you've always gotten. So I am so thrilled for you that you've overcome so much, but we've got to change some things up, or we're looking for a slippery slope when it comes to your physical health down the road.
Yeah.
Well, Dr. Holly, it sounds like Jennifer is trending in the wrong direction, right?
Yes,
But
very much so.
all right, so Jennifer, does that concern you?
It's hard to say because it's hard to really, say oh my God, if I gave up sugar, then what would I have? I would have nothing, then I already gave away benzos. My old friends are gone. Now it's at least I get, tropical Skittles or berry Skittles or, something just, so it would really be challenging, I think, to get off all the sugar.